I'd like to open this Mo-99 producers panel, a secure outlook for the molybdenum supply. My name is Sally Schwarz. I'm president of the SNMMI. I'm from Washington University in St. Louis. I actually am co-director of our cyclotron facility. And I'm very excited to be here today to talk about this overall major effort that's continuing, ongoing daily for the Mo-99 supply. I have been the SNMMI representative to the high-level working group Mo-99, and with that said, I have met a lot of very interesting people, all the global supply chain members, so that takes the reactors and the processors and generator manufacturers and nuclear pharmacy distribution chain and patient advocates, which is SNMMI and EANM. So it's really been a pleasure to be involved with this group and to understand what effort they have made in terms of securing our Mo-99 supply. I really believe that we have a very secure supply. Certainly, I think the panel will demonstrate that to you. But it's really amazing to me how APES is managing, how each of these reactors are essentially developing outage reserve capacity, so that if there is any kind of downtime from a reactor that is not anticipated, they can move supply around and, again, still provide the molybdenum that's needed to produce the generators and deliver the patients their technetium doses for medical care. So it's a long chain, as you all do know. But it's an impressive one, too. And the people involved are tremendous. So I feel like we're in very good hands, even with the reactor in Canada closing its regular production last October. We're still, all of the producers have increased the output from the reactors. And again, they have certainly done a major job, and we are going to benefit from it. What you're seeing essentially is the supply from various reactors. And you can see that there is no place where there is essentially no supply available. So say, for example, on the very top bar, the gold runs, there's a white block, but you can see if you look below it, there's supply coming in. There's the yellow, green, and purple. So in other words, you're looking at all the different reactor supplies, and each one of them, there is no place where there isn't more than one reactor producing molybdenum. So again, this gives you an idea of what APES does in terms of this supply chain. They are trying, again, to manage that if there are problems, they have a solution to essentially move the supply and end up with the total product that is needed. The outage reserve capacity that I did mention to you in my opening essentially exists within systems to account for the fact that all of these producers sometimes have unplanned or unexpected shutdowns. Outage reserve capacity increased in all the reactors used to produce Mo-99 to increase the reliability of supply. Each current Mo-99 processor contracts with reactors for irradiation positions and irradiation costs and an agreed increased level of outage reserve capacity. So again, they're paying for time that they may not necessarily use, but still there is that cost involved. So ensuring adequate target irradiation space for unexpected shortage requires the Mo-99 processor to have irradiation positions access whether or not they are used. So it does cost money to do this. So to be guaranteed of supply, you have to put these kinds of safeguards in place, and we do have to pay for them. So the industry cooperation in planning for the NRU in 2010, the Government of Canada announced its decision to cease routine production of Mo-99, and that was in effect October 31st, as I mentioned, 2016. And since then, the reactor operates the reactor operators and Mo-99 producers have worked in collaboration to plan for replacement of NRU capacity. The investments, improvements, and capacity expansion efforts by 4 manufacturers ensure the security of the supply of the medical isotopes. And what you're seeing in front of you here essentially is the moly capacity at major producers for the 6-day Curie per week, 6-day curie per week. So in essence, NTP is on top, then IRE, ANSTO, AECL, Curium, and then the overall demand is just the red line chain that you see through. All right, so what I'm going to do now is begin to introduce the panelists that will be speaking today from these companies. First is Jane Senior. She is a general manager for ANSTO Nuclear Medicine, which is a subsidiary company of the Australian Nuclear Science and Technology Organization based in Sydney, Australia. And I actually traveled to Australia recently and had the pleasure of a tour of their reactor, and it's very impressive. They were very gracious to me, but I got to see all kinds of the processing plant. I know, I am a geek at heart. I loved it. Jane is responsible for the overall management of both the current ANSTO Mo-99 business as well as ANM, which is currently in the final stages of completion. Jane was educated in the UK and holds an honors degree in genetics, as well as 2 master's degrees in clinical genetics and bioaeronautics. Pretty impressive. After a brief stint in research, Jane moved into business and has held senior positions as director and at the executive level. She's worked across many markets and countries within global, multinational, as well as private companies, operating in highly regulated industries such as pharmaceuticals and food. Jane?
Thank you, Sally. Good. So, as Sally said, I'm from Australia, and for those of you who don't know, we have an opal reactor just about an hour southwest of Sydney, so very good location if you ever do want to come and visit us. And the benefit of the site we have, which is in an area called Lucas Heights, is that we actually have the opal reactor there, which is about 10 years old. We have the new ANM molybdenum plant, which Sally referred to, and I'll talk some more about. And what we will be also building in conjunction with the ANM molybdenum plant is a synrock waste plant. We do currently produce, it's about here on the site, molybdenum, and I'll talk a little bit about the current production as well as the transition into ANM. So obviously the prerequisite for producing molybdenum is a reactor, and as I mentioned, opal's a very new, very modern reactor. It's about now 11 years old, just past its 10-year anniversary, and we have a very good level of reliability and availability for opal. In fact, last year, 2016, we had the highest level of number of days of operation of 304. So we're very confident we have a very secure, very reliable reactor, which allows us to then build our production facilities around and know that we have that secure production available. The current production facility we have, as I mentioned, is was relatively small. It was really built many years ago, but started producing molybdenum around about 2009-10. But now we've actually managed to get the yield and the capacity that we can produce from the current facility with some recent investments of about $1 million Australian to a very good level of production. So whilst we've been building ANM, we've also been increasing our capacity and our ability to supply the market from our current facility. So we've got a very good transition platform to take us from our current production to the new ANM. So whilst customers are moving from Building 54, which is our current facility, to ANM, we can continue to supply from both until we move everybody over. So it's a great backup in that respect. And in fact, one of the recent yield increases we're getting are record yields. The other facility, which is really the one that we love most, and Sally has seen, is the ANM facility, which you can see here. And it's almost finished. I mean, it's virtually built. All the physical infrastructure is in place. And that's a $168 million investment in both a facility to produce molybdenum, but also to process the waste that comes from it. So we've got the two buildings in conjunction. We'll have the synrock waste processing plant online about 2 years after ANM, and that will allow us to treat the waste that we produce from the molybdenum plant. So if I just quickly show you here the difference between what we currently produce and what we'll be able to produce in ANM. So on the left-hand side is our current production, which in itself is now at far higher levels than it has been in the past. We're getting roughly 2,300 Curies a week in terms of production. When we move to A&M, we'll be doubling the number of runs. So we currently run about 5 times a week, sometimes a bit less, but 5 times. We'll be able to do 10 times in A&M. But the biggest difference between our new facility, A&M, and the current is that we can do a lot more runs in a shorter period of time. So as most of you would obviously know, because you're in the market, we need to be able to produce more for the weekend runs to be able to get it to you. And that ability from A&M to actually do several runs in a very short period of time is what will give us the flexibility and the capacity in the market in that peak weekend period. So that's one of the critical differences for us in building this new facility, purpose-built from scratch, is that we can actually do several runs in a very short period of time. In fact, we can do 3 runs in one day. In our current facility, we can essentially only do 1 run a day. And you can see here then the growth in production that we've been getting from our current facility and what we expect to get once A&M is online and will be available to the market. So you can see back in 2016, we were producing at actually quite a significantly lower level than where we are now. We made that $1 million investment in the process. We've been able to grow our production, and then when we expect A&M to come on board, which will be around the end of this calendar year, we'll then be able to obviously sell significantly more into the market. So just finishing off, we love showing pictures of the facility. You can see that it's a great looking building as well as obviously very functional. So I'll just now hand over to Frank DeLonga from Curium. Thank you.
Frank is a Vice President Manufacturing at the Petten plant of Curium. He reports to the COO, Regis Martin in France. Frank is responsible for the operations and financial result of Petten Nuclear Medicine Facility. He also acts as Managing Director of the legal entity in Petten. Frank holds a master's degree in electronic engineering from Tweed University in I can't pronounce it, in Chile. He joined Mallinckrodt in 1993 as a cyclotron development specialist and was appointed head of the cyclotron department in 2000. Preceding this appointment, he joined the Mallinckrodt Maryland Heights cyclotron group in the U.S. for 3 months. In 2005, Frank was promoted to the portrait of manager manufacturing, and in 2008, he became site director. Frank holds a level 3 degree in radiation safety, was 6 Sigma black belt trained, and has led numerous operational excellence initiatives. One of his significant project achievements was the addition of the Maria reactor in Poland to the global Mo-99 supply chain. Frank was born on July 26, 1968, just a baby. He lives in Alkmaar with his wife Nicole and 2 sons, Cern and Jane. He loves to play tennis and talk to his family on sailing trips. Thank you.
Welcome this morning, everybody. The message that I would like to convey today is that reactor-based moly is safe, is reliable, and is here to stay for many years to come. Curium has been investing in moly production over the last, let's say, 20 years or so. We started production in Petten in 1996. The facility was built in early 90s. When Curium, back then Mallinckrodt, joined up with ECN Energy in putting the moly facility in place on the Petten site. On the top photo there, you can see the blue buildings, which is actually the Curium production facility. Is this pointer working? Yeah. So here, obviously, the nuclear reactor, the HFR reactor. Well, and here is the moly production facility. The investments that we made were related, amongst others, with the conversion from highly enriched uranium to low enriched uranium. Actually, that's taking away some of the risk in our supply chain, not being dependent on highly enriched uranium. And this project has been run for the past 6 years, and we were very close to finalization. And we think we will be ready to fully convert to LEU-based moly in the 4th quarter of this year. As you can see, most of the approvals has been obtained from the health authorities in the US, in Canada, and in Europe. We expect some of the Asian markets to approve LEU-based moly soon now. The work that has been done in the LEU conversion obviously had led us to look into many of the production steps that we have, amongst others the waste treatments. So we were able to actually learn a lot more about our HEU process and introducing some improvements along the way of conversion to LEU. Along the way we also added some reactor positions in order to cope with the slightly lower yield that LEU targets would generate, but to compensate that additional capacity was hired in the reactors that we are working with. Some of the capital investments we did are around these new positions that need to be equipped with target rigs or target facilities. So in all reactors, additional facilities were built, and we also invested in a new target transport container to cope with the additional targets that we are going to process in our facility in the years to come. So talking about the capacity expansion, as Sally talked about, there's this concept of outage reserve capacity that we use in order to cope with any unforeseen circumstance that we might face. So there's an ability to switch from one reactor to the other reactor. And as an example, we are using the HFR reactor in Petten, the BR2 reactor in Mol in Belgium, and then also the Maria reactor in Warsaw in Poland. And if you add up all the weeks of availability of these reactors, it's like 40 weeks, and 20 weeks. So in total, roughly 100 weeks of availability, which indicates that there's, let's say, always another reactor available for us in case one of the reactors would have an issue irradiating our targets. Besides that, we increased our production capacity by adding one additional production per week. So we used to run the moly facility 4 times a week. We have now capabilities to do that 5 times a week, and we are very close to finalizing the project to even do 6 productions per week, thereby increasing our capacity even further. If we talk about capacities, obviously not only the moly facility itself, but also the reactors that we are using, and all the 3 reactors that I just mentioned have done major overhauls, major maintenance programs in the reactor to be more reliable, to even also extend capacity. BR2 reactor has been offline in 2015 for most of the year, but has become did get back to being able to supply us with irradiated target at an even higher level than before this outage to replace the beryllium matrix. There has been several upgrades in the HFR reactor as well as in the Maria reactor over the past few years. This all leading to the graph here on the left-hand side. You can see from the start in the second half of the 90s until today, you can see stepwise increases of our capacity throughout the years, mainly driven by the additional productions that we can do per week, but also, for instance, the number of targets that we can process in one production run, which has been 8 most of the years, but around 2009 or 2010 we were able to increase the number of targets from 8 to 12. So together with the additional positions in the reactor, with the additional operating days in the week, we were able to get our production capacity up to more than 4,000 curies today. Obviously, this capacity is helping us to be a reliable supplier. We do not need that full capacity each and every week, but in case something happens, we are able to scale up and use that additional capacity to serve our customers. And on the graph here on the right-hand side, you can see our service level for the last 2 years, in which I added all the customer demands that we had in 1 month and made a ratio between what we actually delivered and what was requested. And you could see that we are very close to 100%. Most of the months we are at a full 100%. There's no month in which we were lower than 97%, just as an indication that is a very reliable supply chain that we are managing together with our partners in the reactors. So in summary, Curium has established arrangement with a diverse network of irradiators, of reactor operators. We have taken steps to improve our process to increase reliability, which goes hand in hand with the increase of capacity. And we feel that the current moly producers have made significant strides to further increase the reliability. We have arrangements in place among, well, the four of us in order to cope with any unforeseen circumstances. So also Curium is using material from South Africa, from Belgium, and from Australia in order to serve our customers. So thank you for your attention.
Next speaker will be Jean-Michel Vanderhofst, General Manager of IRE, Institute of the Radio Elements, and IRE Elite, Environment and Life Science Technology. He's president of APIS, Association of Imaging Producers and Equipment Supplies. Jean-Michel graduated from the University of Liège and Brussels in Belgium, where he obtained his degree of industrial pharmacist and post-degree in business management, respectively. From 1986 to 2004, he worked for SCA Molink in Belgium, Ireland, Czech Republic, and Sweden as quality control manager, product developer, production manager, site manager, general manager of the Czech subsidiary, and R&D surgical business director, Gothenburg, Sweden. In 2005, he took the position of general manager of a large Belgian company active in food sector, and since 2008, he is general manager of IRE Flores, Belgium. He is also president of the company Transrad, specialized in the transportation of nuclear material, and represents IRE as director of Sturgenics and Oncidium. He is appointed lecturer at the University of Liège, Brussels, and Louvain. You can tell I don't speak French, being in charge of a course on business management. Thank you very much.
So good morning, everyone. I will briefly speak a little bit about IPIS, since I have the pleasure to chair that association. This chart is exactly the same as the one Sally showed earlier today. I just want to mention two or three things which are really making the complexity of our game in this business quite significant. The first thing in the planning of all our activity, and it's a big challenge, is that, as you understand, all the reactors are working with cycles, and they need interruptions to refill and to make maintenance. But we are in a totally just-in-time system, business model. So the next step must be constantly producing. We are not allowed to stockpile any single curie of moly because it's decaying so quick. So the challenge of the industry is to work with an interrupted source of irradiation. But at the end of the day, the patients need their dose every day and constantly. And IPES is really, together with all the stakeholders here and our colleagues, really working hard to make sure that this interruption in the cycles are converted in a movement. It's like an engine of a car. You know, you have a piston and it should run constantly all the year long. So that's a big challenge. This reactor schedule, we started it in Europe. I think IRE, before my time, was at the initiative of that. It was at the very beginning only the reactors in Europe. But as you can see, and as Sally mentioned, we are now working with all the reactors worldwide. So in South Africa and Australia, Czech Republic and Poland, but also you see on the graph there still NRU is shaded, but still there as a backup in case of, until next year, something would happen. So they are prepared to enter into the system if needed. And we will include also in that reactor scheduling the newcomers, namely the FRM2 reactor in Munich, which will come into operation next year, or in commercial operation in 2019. And then later on, a couple of years later, will come the reactor in France, Gilles reactor, which is now being built. It's a big thing, and which will come in operation in the year 2001 or 2002. So even though we are working with aging reactors, there are newcomers into the system which will provide your security of supply for the next years. And thereby, I just want to mention that this business really is, well, it's a business, but it's also a healthcare duty, and I want to emphasize that this is a global market, and it will remain a global market whoever entered the business. And we at IPES want really to act at the global level together with the ANM, the SNM, or the association in the other continent like Asia, because the relation between nuclear medicine and industry is really a key success factor for healthcare, we believe. And I think everybody will agree on that. So, oh, sorry. I have a short presentation of what we are doing at IPES. We took a change in the management of IPES after the last General Assembly some months ago, in May, a month ago. And as you can see on this chart, I will not enter into all the details because then I will consume all my time. There is a main stakeholder in the middle there, which is the word patient. So we have decided, the industry, all our members, we are representing all the industry almost. We have decided to be patient-centric into the approach of the industry to yourself, all of you in this room. And around the patient, we have tried to organize the work that IPES is doing based on these 6 elements. You have innovation, because we want to promote the new modalities, the therapy, the theranostics, and new modalities. There is fantastic momentum at the moment, as we see in the business. We have a regulatory group working with the facilitation of the relation of the members to the authorities. One of the issues there in the future is to make sure that the drug approval of new components will be facilitated with all the respect for the patient safety, but we are not traditional pharma industry. We are something a little bit different, and we want to make sure that all the regulatory bodies worldwide understand that there are some differences in the management of the regulatory matters. Then we have a group working on awareness, increasing the awareness among the population about what nuclear medicine is all about, and the low level of risk that it will imply for the population. You can see some of the material produced on our website. We have a group working, it's a new working group on health policy. We want to promote the benefit of nuclear medicine in terms of social security, cost and benefits for the different countries worldwide, trying to propose some material to facilitate the understanding of the decision makers that this business, nuclear medicine, is really a cost-efficient way of contributing to healthcare. And then we have also a group which is more focusing on Europe, facilitating the transports, because transport is part of the logistics in this just-in-time model. So transport is a very key issue. Then the last group, and this is the purpose of this meeting, it was called Regulatory Reactor and Isotope Working Group. We have changed the name to be patient-centric. It's now security of supply. And that's where we find this reactor scheduling. We have created an emergency team there. So in case one of us or a reactor foresee the problem or as a problem, like a scrum or something unexpected, this crisis team is getting together. It's very efficient. And generator manufacturers, processors, reactors get together during the day, take actions, and thereafter communicate to SNM, ENM, and whoever. It's a communication thing, tool. It's an action planning tool, crisis type of management, but we are convinced that if there is an incident coming or a risk, communication to you all, to the patient, to the hospital through your association is key, and information is a very high value. And this team is performing, I must say, perfectly well. And I'm happy that you in the hospitals, you have not noticed that during the last years, we have activated this team on some occasions, and it has been a flawless performance with some very small exceptions for the last years. And then we have communication protocols also to other bodies like the authorities and the healthcare authorities in the different countries. So that was about IPES. So I have 2 more minutes to speak about my hobby, which is managing IRE. So IRE has been created a long time ago in the 70s, but started production in the 80s, so we have a very long experience in producing the moly. The mother company is called IRE. And in IRE, this company, we produce mainly the Mo-99, but also the iodine-131, which is an important component, and also now the xenon-133 for the US market only. We are the only producer in the world making this xenon isotope for the moment. And we are, as our colleagues here, CGMP approved at the grade API, meaning active pharmaceutical ingredients. So we are about 250 people. We produce 3 days a week. Our capacity is much larger. We could produce almost all the market demand, but our license is only for 3,500 curies a week, say 1/3 of the market demand today. And we produce typically like 25% of the global demand on a weekly basis. And we have created a subsidiary company called IRE, where we put all the radiopharmaceutical activity, and we are working very much for the moment with a new product that we have developed last year, which is a gallium generator, which is a newcomer into our portfolio. Okay, so as similarly to Petten and Frank has mentioned, we are also using 3 reactors. It's the BR2 reactor in Belgium, which has been fully renovated in 2015. They stopped for 18 months, so you can consider it's a new reactor in the design of its components. We work with HFR, which is based on Frank's site in Petten. And then we work with the Czech reactor LVR15 in Prague, nearby Prague, which is very efficient and very flexible and has been put into our system during the crisis times of 2009 and 10. And together with Maria, I think it was about the same time, these 2 reactors in Eastern Europe has really contributed to mitigate very much the risk of shortages ever since these years. And for you, if you want to come, it's less exotic than Australia or South Africa, but you're welcome to come. We are located 60 kilometers south of Brussels. Fantastic weather all year long. It's a little bit more humid than your country. Okay, some metrics, but it's probably no point to go into the details, and it's very difficult to read there. But we have enjoyed a very continuous production for the last 8 years. We have not stopped very much. Actually, we stopped one day a year ago when we had the terrorist attack in Brussels because the transport were banned for 24 hours, and that was, of course, unexpected. And we had only 1 week of interruptions for maintenance in 2015. Otherwise, we have run all the week around the clock since 2008. We have made big investment in capacity increase. We have increased the capacity by 50% in 2015. I don't want to run full capacity. So in some cases, we don't take orders from customers, from new customers, because we want to keep reliability, and I want to keep a margin on top of my utilization of the plant for unpredictable demand and also for maintaining the plant. Because one thing that I would like to convey to you again and again, the problem that you faced, or we faced in 2009 and 10, was not a capacity problem, because the capacity was there. The problem is reliability. So the word reliability is key in this business. The word capacity is important, of course, and we need touch reserve capacity, but the main issue is reliability, and that's where we have at IRE invested massively, tens of millions for the last years, also in reactors. We are, as well as Petten, investing into the LAU conversion. We are now in the last phase of the project, and we'll hit the market with the LAU in the next months, scaling up during next year. But we have 2 lines, so it will not affect at all the security of supply. Our performance in terms of hit rate and the service level is flawless. We have 19. You see all the graphs. It's a red curve on the graph, which is down there in the right corner, and this is a performance of 99.5 year after year since 2010. It was a little bit worse in 2010 because of the lack of reactors at that time. With that, I conclude my speech. Thank you very much.
Good morning. My name is Roy Brown. I'm with Curium. Sally had to go over to the plenary session as president of SNM. Sally is turning control over the society to Dr. Greenspan this morning, so she had to leave a few minutes early to get ready for that plenary session this morning. So it's my pleasure to introduce Pete Lau from NTP Radioisotopes. He's the executive manager there. Pete qualified as a nuclear engineer, specializing in reactor physics, and started his career with neutronic reactor design and optimization of nuclear reactor operations, focusing largely on South Africa's Safari 1 research reactor. Pete was instrumental in the initiative to commercialize Safari 1's utilization, a project that led to many commercial radiation-based products, including Mo-99. Following the inception of NTP radioisotopes in the late 1990s, he assumed responsibility for the commercial manufacture and supply operations of this organization. Pete formed part of the management team that grew NTP from the humble beginnings to where it is today as an acknowledged leading global supplier of reactor-based radioisotopes. Pete currently holds a position as executive manager at NTP, a company that is committed to the reliable and sustainable supply of Mo-99 to the global market now and into the future. Pete?
Thank you, Roy. Ladies and gentlemen, it's a big honor for NTP to be associated with a prestigious group of people like yourselves. We're so happy to be associated with nuclear medicine. And our goal has been from the very beginning that we would like to make a difference. We would like to make technetium available to patients. And we've been doing so for the past, say, 20 years, where we believe that we have been able to supply molybdenum very reliably to the global industry. And that is our commitment also going into the future, that we would like to be part of the technetium supply chain for many years to come. We have many examples in the past where we were able to assist during crises, international global crises. And our intention is to continue to do that. Jean-Michel mentioned that the reliability of supply is more important than anything else. And as such, we understand that responsibility. If we want to be in nuclear medicine for many years to come, then we will have to make certain investments. When we started with our molybdenum manufacture back 20 years ago, and we had to give a presentation like that, we would say we have world-class or state-of-the-art production facilities, but that's 20 years ago. And you cannot rest on your laurels, and we're certainly not doing that. Today I would like to share with you all the investments that we are making, capital investments that we are making into our facilities, and also what we're doing to expand the capacity. And then I would like to share with you a little bit about our supply metrics. But before I want to do that, I must just put NTP or South Africa then in perspective. We are in a very fortunate position, if you wish, that we have our own dedicated nuclear reactor that we can use for the irradiation of all our various targets to provide the radiation products that we do, of which molybdenum, of course, is the biggest. Now, that's a fantastic opportunity to have your own reactor dedicated to this. It comes with a big disadvantage, though, because you, as NTP, we are entirely and totally responsible for the operational cost of that reactor. Now that, of course, not only includes the operations, day-to-day operations, but it includes other things. We can talk about waste, but more importantly for the purpose of this discussion, the investments that we have to make to ensure that this reactor is still going to be available 20 years from now. And I will show you a little bit later about the power history of the reactor. We believe that in our reactor, we potentially still have very safe and reliable operation of this reactor ahead of us until 2020. But then we have to make investments in it today. So I'm going to talk to you about the investments that we're making in our reactor. Secondly, our processing facility. Now, the processing facility is impacted by the fact that we have converted to low-enriched uranium. We are very proud that we are, to date, the only molybdenum producer that successfully converted from HEU to LEU. These days we are running full LEU, and it has very different implications. It requires capital investments. It challenges your capacity, and I would like to share with you what we're doing with regards to that. The last point that I want to touch on will be waste, because again, when you convert to LEU, you are generating lots of additional waste, and I would like to share with you on what we're doing in that regard as well. So there you can see a photo of the Safari 1 nuclear reactor. We have active lifetime extension programs that we are following in this reactor, because we want to, well, first and foremost, secure the safety of this reactor, but secondly, to Jean-Michel's point, its reliability. And we believe that we can do that successfully up until 2030. In addition to that, it's just the normal day-to-day maintenance, but what we believe is we do what we call proactive maintenance, and the fact is that the reactor is aging, and therefore we do identify all the critical components that could potentially give us challenges, and we replace them or modify them or do whatever is necessary long before it is due. I have to also mention here that in the interest of reliability of supply, we have from a reactor point perspective, we have very close collaboration with our colleagues at Petten and also our colleagues in Australia, where our operational people share experiences to ensure the availability of our various reactors. Ladies and gentlemen, I want to highlight here that even though Sally in the beginning said that we're sitting in the front here, we are competitors, and it's true. That's on the one hand. And of course, the commercial side of things are important to us. But there's one thing that's more important, and that is to make sure that you and the patients have molybdenum or technetium. And therefore, we do cooperate on a non-commercial matter in many instances to ensure that the product gets to the customers, even though there may be a hiccup in any one of our production facilities. And this is an example with our reactors cooperating very closely to ensure the availability of these reactors. In our processing plant, the production cells for HEU is just different to LEU, and we had to make significant capital investments to accommodate that. And the same with waste infrastructure, which I will rather maybe cover in the next slide. There you can see a picture of our processing facility. To increase our capacity, and maybe I must just first put that in perspective, it is not so much increasing the capacity, it's rather to retain the HEU capacity. Because, ladies and gentlemen, when you convert to LEU, you can lose up to 20% or more of your capacity. And we didn't want to do that. So we had to make further capital investments to increase the radiation capacity in our reactor to try and compensate for what we are losing with LEU, and I'm happy to say that we've successfully achieved that. In our processing facility, what we have done there in terms to also expand the capacity, and again, I just qualify, rather retain the LEU capacity, we spent lots of time and money in really fine-tuning our LEU process, and I'm happy to say that after probably a few years of struggling with it, we are in a position now where we can successfully do that, and at least the theoretical yield that we're getting out is at least now comparable to what we used to get with LEU. The increased volumes associated with LEU is really very, very significant. And if we talk about capital investments, we really had to invest a lot into waste management infrastructure to accommodate the increased volumes. But of course, you would say, but what does that have to do with the increase in capacity? But ladies and gentlemen, if you can't treat your waste, then you can't do your production. I would like to share with you now a little bit of our supply metrics. Now, the first I want to highlight is that blue graph on the left-hand side. And all that I want to highlight that is the reactor power, historic reactor power of Safari 1. And the highlight that I want to show is that from 1977 to the early 90s, this reactor is operated at a very, very low level. It was only thereafter when we embarked on our commercialization projects that we started to increase the reactor power. What is of significance for you people in the audience today is that even though our reactor is old, it has a very low power history. So if you take, this is a design lifetime of 40 years at 20 megawatts, and if you had to extrapolate that first line on the left-hand side, the red line, for 40 years, that will bring you to the design end of life of this reactor, and that is only in 2030. So we firmly believe that if we continue to look as well as after our reactor as we're currently doing, that we will have a reliable reactor available until then. The table on just right to the right-hand side of it shows the availability of this reactor. That is scheduled uptime versus real uptime. And you can see for many years, we have a very, very high reliability in our reactor. In fact, the Safari 1 reactor, with maybe one exception in the world, is probably one of the highest, the best utilized reactors with the highest availability. The graph at the bottom shows the molybdenum that we manufacture, and to just give you an indication of the reliability of our output. And maybe it doesn't look too impressive to you because there are a bit of ups and downs and so on. But ladies and gentlemen, I want to highlight that this covers the entire period when we were doing LEU production, conversion to LEU. So one should have expected lots of dips as we are struggling to get to grips with LEU manufacturing is not there. I then want to say in conclusion that NTP has a long-term vision. We want to be in nuclear medicine. We want to be in the technetium supply chain for many, many years to come. We believe that in 20 years from now, there will still be a big demand for technetium, and we want to be there to service this industry with this technetium. So we're committed to it, and we are making the necessary investments, and we are confident that we are going to continue to support you in a reliable manner. Thank you.
Okay, let's go ahead and wrap up then. We've heard this morning from the four major producers of Mo-99. You can see from the presentations this morning that the major manufacturers have made significant strides to increase capacity for both the planned and unplanned outages of the reactors that we all use. The Mo-99 producers have worked closely in collaboration to replace the capacity that we lost with the NRU reactor last year and the Osiris reactor that we lost in 2015. Fortunately, we had several years of knowledge knowing these reactors were going to shut down, so we've had time to prepare for that and increase capacity before these two reactors were lost. Also, we've heard this morning that the four major manufacturers have made significant investments, capital investments and improvements to increase the security of supply both currently and into the future. We've seen evidence of that in the four presentations this morning. These investments and the increased capacity significantly increase the reliability of the Mo-99 supply into the future, and I hope you've seen that this morning. So with that, let's go ahead and close. I want to thank the four panelists for participating this morning. We appreciate all your time and effort that you put into it. I'd also like to thank all of you for attending this morning. I know it's very, very early to get up on a nice Monday morning, but we appreciate your attendance here and you getting up early. And enjoy the rest of the meeting. Thank you.